Evening, more local frontline healthcare workers are getting Pfizer's COVID-19 vaccine. Just after 5 p.m., Ascension St. Vincent Hospital started vaccinating several of their employees. This comes a day after IU Health vaccinated some of its own healthcare workers. And developing tonight, a United States expert advisory panel is backing Moderna's COVID-19 vaccine. The next step is an FDA vote to determine whether Moderna's vaccine will get emergency approval like Pfizer's. The FDA usually follows the recommendations of that advisory panel. An FDA vote can come at any time. As the vaccine begins to roll out to healthcare workers this week, IU Health already began vaccinating their staff yesterday, and Ascension St. Vincent is beginning today as we speak. We wanted to answer some of the most pressing questions you might have about the vaccine. WRTV's Stephanie Wade is working to answer your questions tonight.
As the vaccine is rolled out to frontline workers, people in the general public are starting to think about whether they will want to get the vaccine or not once it becomes more widely available, and have many questions surrounding the vaccination process.
As any new vaccine, right, there are still going to be some unknowns in terms of how long that immunity lasts.
There are still many questions waiting to be answered about this new COVID-19 vaccine.
What are the side effects of this vaccine? I think people are worried about side effects.
You're debating, should I or shouldn't I, right? Think about your risk factors. So if you are high risk, if you are over the age 65 or 75, right? Do you have other comorbidities? Do you have heart disease? Do you have respiratory conditions? Are you overweight or obese?
People with any of these pre-existing conditions, health experts say, should be at the highest priority for receiving the vaccine. Both IU Health infectious disease specialist and UIndy assistant professor of public health agree. You might have some side effects like any other vaccine.
You start getting those fevers, fatigue, headaches, muscle aches, and it looks like you have the virus.
But those will resolve within a day or two.
I just want people to know that even if you get them with the first dose, please take your second despite those side effects.
With both the Pfizer and Moderna vaccines, should Moderna get approved, you will need to get 2 doses for it to be effective. Otherwise, you won't be considered protected from the virus. Pfizer requires a 3-week period in between doses. Moderna requires 4.
Should I prefer one manufacturer's vaccine over the other? I think I can tell you that they all went through the same vetting process, right?
There are more differences in how they're stored and what temperatures they're stored at, but from a medical perspective, they are very, very similar.
Some people also worry of an allergic reaction to the virus in some reported cases.
The 2 that had it in Britain had already were prone to get severe allergies where they had to carry an EpiPen around. So this is not your typical, I have an allergy to penicillin or I have an allergy to food.
They expect doctors will alert patients once they have the vaccine to schedule their appointment. Which vaccine people receive, however, will likely come down to access. It's also unclear how long the virus might protect you.
I think that's a question that is a magic ball question. We don't know. We have seen that there's at least 2 different strains of COVID that are out there, that it has mutated. Is it something that will continue to mutate?
Stephanie Wade, WRTV.
At this time, the vaccine is not approved for people younger than 16 years old. They have only been monitoring the clinical trial for a few months, so it's still unclear about any long-term effects. To reach herd immunity, experts say we need 60 to 70% of people to be vaccinated to stop the spread of the coronavirus.